You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I'm an holistic nutritionist and a professional cancer coach. In today's episode, my guest, Amelia Vogler and I will be talking about a profound and often overlooked dimension of healing, the energetic and spiritual journey that surrounds surgery. Amelia is one of the few practitioners in the world to earn the distinguished credential of specialist in energy medicine, with advanced training in energy medicine and surgery. Amelia brings an integrative and deeply intentional approach to her work, drawing on medical intuition, somatic-based trauma healing, clinical recovery, grounding practices, guided imagery, spiritual coaching, and advanced energy medicine techniques. Her sessions are both spiritually attuned and therapeutically grounded, designed to support the whole individual, body and soul. At the heart of her mission is something extraordinary, helping individuals who feel incomplete reclaim the parts of themselves that feel lost. She guides people home to themselves, helping them reconnect, realign, and enter surgical experiences with clarity, confidence, and energetic integrity. Whether you've had surgery, are about to have surgery, or simply want to understand the deeper layers of healing and integration, this conversation will expand your perspective of what true recovery can look like. Stay tuned, everybody, and we will be back in just a few minutes to speak with Amelia.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back to the Health Hub. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub RMC on all of those locations. And please do follow us, follow our podcast. We are on all your favorite podcast sites. Amelia, welcome to the show.
Thanks, Cathy. Hey, everybody. Thanks for listening.
This is, a very interesting show I'm very much anticipating because it's an area. I've had many surgeries, and I wish that I had somebody like you alongside some of them. And for great reason, as you're all going to find out. You're one of the, I believe you're one of the few practitioners worldwide with the credential of specialist in energy medicine. What does that designation mean, and why did you want it?
Yeah, thank you, Cathy. So SEM, Specialist in Energy Medicine, was a credential that came through the late Jana Moll. She's no longer with us on the earth plane, but she started a school 15 or so years ago that really took energy medicine into what I considered one of the most ethical, complete, and client-focused practices that I had ever come in contact with. And Jana specialized in a system or dimension of energy called the hara, H-A-R-A. It's a very little known dimension. And it's also, to me, the one that I was most deeply called to because it's so foundational to who we are. So for me, specialist in energy medicine really encapsulates the container of this is somebody who knows not just what to do and how to do or work in energy, but how to do that in one of the most ethical and client-centered perspectives that I could find.
And why did you want to become a specialist in energy medicine?
Well, that is my dedication in practice. I deeply believe that we are more than a physical body, and that more, as I continue to explore the moreness of us, it drew me into the constitution of energy. And all of our scientific disciplines will tell us that we are not a material being. We are light vibrating at very, very high frequencies, so that constitutionally any ailment, any illness, any disserving thought, any pattern of being really rests in our energetic constitution. And so for me, it was foundational medicine. It was a way to really bypass, not bypass because it works in concert with Western medicine and traditional Chinese medicine, but it allows us to integrate rather the who we are at our essence and bring that into our medical conversations.
You must have seen and be seeing leaps and bounds in the acceptance of this type of energy medicine idea, philosophy. When I started in integrative care, starting my nutritional program, the idea of energy was really out there. It was woo-woo. It was, you want to eat the type of food that has high energy. There are energy machines, and if you can put your energy up to a certain level, you'll be cured from disease. We've come a long way from that and speculation on that front to a lot more, as you say, scientific research on us and energy. And when you think of the body and the what we need to make it run, it's all because of an electrical system, correct?
That's correct. Yeah. Our mitochondria is cellular energy. It's how our cells get its energy. And so we can then begin to ask the broader question, well, how is it that we nurture that aspect of us nutritionally, vibrationally, through our thoughts? And over the last 2,000 years, we have developed on Earth many, many different ways of supporting our energy. And traditional Chinese medicine is one of the oldest and is still being used today. So in some ways, I think we're seeing a return to our ancient wisdoms. And I really appreciate that, because I think that we have known deeply as a species of human how it is and what aspects of our anatomy we need to be looking in to support our health and well-being.
And how has this proceeded to be accepted within the medical space?
Well, I know that there have been a lot of different inroads into the traditional Western medical model, but to speak more personally, the path that I chose was through a modality called Healing Touch. And Healing Touch program is an energy-based modality that was intuited by a nurse. And her name was Janet Minkin. And as she was beginning to understand the connection between energy and health and energy and healing, she would come to her patient's bedside in the hospital system, having exceptional talents with energy and being able to see, sense, smell energy of her patients. She would begin to notice corollaries between pain spikes and this, heat that she could sense and feel above the body. And so she started doing these very simple hands-on methods. It's like, well, if there's a heat spike here, let me see if I can move that with my hands. because we're electromagnetic beings, sort of like that magnet toy that perhaps some of us had as children, where you would run a little magnet over a bunch of metal shards and they would jump up on top of it. It was, she used that premise to start working with the energies that she was seeing correlated with the illness patterns or disease patterns of her patients. And she was also being guided, try this, do this, just by that inner wisdom in her. And now Healing Touch is taught worldwide. It's accredited by the ANCC, which is the American Nursing Credentialing Center. So they can go and receive this type of training as their, for some of their extra hours for their nursing licensure. And Healing Touch and the nursing 10-step sequence, they follow each other almost exactly. And so when I was certified in that modality, I could go into the hospital systems and say, I'm a Healing Touch certified practitioner and instructor. And that would mean something because of that accreditation. And that was the way that I really saw a very one-to-one partnership between this language of what I would call clinical energy medicine and in the Western medical model. And then just quickly, we're also seeing with the advent of new technologies and the ability of diagnostic and also therapeutic energy-based machines, we're seeing those pop up all over Western medicine right now.
I don't think you need scientific research and years of discovery to understand, when we're talking specifically about healing touch, how much the touch of one human being to another when one is in distress or ill, how much that physically changes a person.
Absolutely.
It just doesn't need to be done. We lost my brother-in-law to COVID, and he was alone. And of all the things surrounding all of that was the fact that he was alone and no one, he had to, because of the situation, no one is to blame. But the profound sadness because he was alone always stayed with me. And I don't think it's a far stretch for anybody to understand the power of a healing touch or the power of presence of somebody in a room. And so it's just wonderful that you're taking this and you're taking it to the next step, and you're moving within the actual surgical space, because there's so much that goes on emotionally as well as physically that I think you must have a profound impact on.
I would like to hope so. I defer to my patients around how it is that they feel supported, but my highest hope is to move myself in places where I can be of highest benefit. And in the surgical space, I feel as though I sometimes joke and say this is like my Olympics, because it is every single form of energy medicine or energy modalities that I have in my toolkit over the last 20 years. I bring every single one of them into that space, and not just into surgery itself, but in the weeks before or days before, and in the weeks and days after as well. So it's this full walking with, as you so beautifully invoked the word presence. It's a healing presence before, during, and after, with very, very specialized skills and tools.
Would you consider yourself this could be a very wrong way of addressing you, but it almost sounds like a doula type of role.
I've heard that before, Cathy. I think it's a really wonderful designation. It's an honorable designation. It really speaks to the walking with and being a part of.
And so you're blending when you talk about all the modalities. Are we talking like medical intuition, energy medicine, spiritual coaching, guided imagery? Are all of these part of your process?
Absolutely. And also trauma-informed care, a lot of different trauma, energy-based trauma modalities, movement therapies, especially before surgery, if it's possible, just helping people literally, even if it's just a finger that represents their body moving through. We do sort of embodied ritual, just depending on where my clients are and what they're needed. But you really nailed it, from guided imagery to different types of hands-on or by distance energy therapies, medical intuition, different aromatherapy in pre-op together. We use different vibrational oils and essential oils to help calm the nervous system if it's needed. So it really just runs the gamut.
A lot of people are familiar with the physical preparation for surgery, what not to do, what to do, but we don't. Not many of us, and I for certain did not prepare energetically for surgery. It was not even, in my headspace to do that. Well, how would you define energy medicine in surgery? What are you looking to accomplish?
I think first and foremost, a deep dedication to partnering my support with my client's highest outcome. And I'm not really talking about getting a knee replacement and then being able to walk again without pain. I'm talking about getting the knee replacement, being able to walk without pain, and being able to lean down and hug your grandchild. And being able to really use and integrate that new knee into the fabric of your life story in a way that it allows you to feel whole again. And that wholeness, because the surgical process typically includes being cut into, having something altered or removed and then replaced or altered in some way, there's a sense of, I'm not going to be the same as I was before. And so the surgical process in energy medicine helps someone kind of move that awareness from not being the same to still being whole. And
can somebody have your work done, or can somebody work with you who has long since been removed from a surgery? And the reason I'm asking this is because, when you're talking about a knee replacement, that's it entails everything that you have said. But when we're talking about, because of my background and my bent within integrative care, when we're talking about somebody who's had surgery because of a cancer diagnosis or something, disease related, whereas we're not talking about a joint or something like that. Do you think there's work to be done many years post-care if nobody is actually considered working on their energy space?
Oh, I think it's absolutely. There's many, many different options and offerings of how that support could look post-surgically, even down the road. I don't like to throw the word trauma around. I think it's very much overused and it's not well defined. But what I would want to hear from someone who came to me years later is first, well, what is still present with you from that experience? And listening for patterns of, well, I never really felt like myself again. That's really important. Or I feel like there's something that's unfinished. That's important. Or I'm having haunting memories from part of that procedure. Or I never really felt like I got the support that I needed before. And I'm very, I'm feeling angry, or I'm in my feelings about that. All four of those examples would kind of move us in different directions in terms of what that aftercare support would look like. So some might be more trauma focused, having kind of looping nightmare, never really felt okay in the body. We may go down a different avenue of how to support that client versus the one that was feeling lack of support.
But what happens to the person's energy system as they undergo surgery? Why is there this soul body connection and that becomes misaligned? Why does that happen at all?
Well, and it doesn't happen every time. I think it depends a lot on the preparation that an individual goes along, the preparation journey someone's going along in their own life, because I think our energy being it so constitutional, I think each of us has a deep relationship with this part of ourselves that's needing attention. And there's some folks who are really skilled at listening to their inner world and saying, I think maybe I should get a little counseling before this surgery. I'm just not feeling great about this. And they attend to, through talk therapy, some of the issues and concerns that they're having, which may help them then bring or bridge those soul questions with their physical experience. And then there's others who may feel like, I don't know how to name it, but there's something in me that's unsettled about this upcoming procedure. And it's the whispers of that unsettling that I would encourage folks to pay attention to. And it's not just your basic nervousness. Everybody's nervous before a procedure, especially with anesthesia. But it's this inner restlessness that's what tells me that the soul and the body aren't on the same page yet. That there's this deep kind of, I don't know how to be with this. And I think that's one of the main, I guess, diagnostic tools I would use to say, hey, we're in the space of the soul here. We want to address that restlessness. And then, some folks also come into surgery incredibly anxious about anesthesia because during the surgical process, you are giving your control. You're giving that natural control that you've always had around soul and body, breath and lungs, and, the okayness that we live. We're handing it to someone else. And we're handing over a lot of our agency, almost all of our agency in the physical form, to others during that procedure. And that is where the soul and the body begin to have some questions come up about, how do I stay embodied if I'm not in control anymore? And so that's where I think that link starts making itself quite apparent, is when there's a deep, unsettled nature around anesthesia.
Well, anyone who's had surgery also knows that there are several warnings that are presented to you before surgery, and that too, in and of itself, can cause unrest and unsettlement. And I would venture to guess could raise questions of whether or not they actually want to go through with the process. So it calls into question a lot of things. Are you working with people to try and go through these questions, or that's kind of not your thing? This is after surgery is decided and we're going to move on to it.
No, actually, it depends on the person, of course, but I'm working with a young woman right now. I've been working with her since March. And there's a surgery that is needed. It wasn't imminent. It wasn't, you need it right now, but it would be in your best interest to go through with this. And when she came to me, she was terrified, and she was sensitive. And being a highly sensitive person myself, I understand that when we take medicines that other people take, it's a completely different experience in our body. We need less of certain medications, and having too much really can wreck our system. And so the first part of our working together was helping her feel empowered and in control of her surgical process. And that journey of hers, she said in our very first meeting, I really don't feel comfortable with this surgeon. And the coaching around that was about, well, what other options do you have? Who else can you talk to? What has your research looked like? And can I support you in doing some research on the side? I'm not trying to change her mind, but just trying to offer additional information. She flew out to California and she talked with some surgeons there. She tried a different surgical model. And now she is 2 weeks out of a procedure that will be done at Mayo Clinic in Minnesota. And she has found an absolute specialist in what she needs. It will be done laparoscopically, so there's less risk. It's a cleaner type of surgery. And she is feeling so empowered. There's still fear and concerns, but we're addressing those as we go together. So sometimes the process at the beginning is having someone give you permission to keep looking.
Excellent. Okay, let's take a quick break here. We'll be back in just a few minutes, everybody.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back. We are going to continue our conversation with Amelia Vogler. Amelia, are you in the surgical room ever?
I was trained to be in the surgical room, and that was really interesting for me. But because of how sensitive I am, I actually do my work better when I'm sitting in the waiting room. And so what typically will happen is I will be with my clients during their pre-op, the weeks, months, days ahead, depending on when the surgery is coming up and how much time they have between it. Then I will, there's 2 variations where I will go with them and I'll meet them. So I will be going next month to Mayo Clinic, and I will be working in that hospital. I will go with my client from check-in all the way through pre-op. I will go back to the waiting room and do my work there. And then I will arrange, with the surgeon's permission, with the client's permission, to meet her in the post-anesthesia care unit. And I really advocate to try to get there right after they've taken the breathing tube out. As soon as I can come in and support energetically, the faster folks come out of their anesthesia and the least stomach upset and headache. That's been sort of typical just as I keep my data. Then I will stay with them through recovery. And sometimes that means if they're staying in ICU for a few days, I will just work in concert with what's allowed in terms of visitation, or be locally doing more distance-based energy work.
What has feedback, or have you had any feedback from the surgical teams been like, from doctors?
I love the feedback I get from the surgical teams. It has been absolutely confirming and enlightening. And usually I hear things like, wow, that went really well. It was like my entire team knew what to do before I told them. Or it was like the tissues were moving themselves. That I've heard that 3 different times. And what I do is I study these surgeries in depth. So I'm following the energy of the tissues, and I'm very empathic and I can feel very deeply. So if we need to move a muscle out of the way, then I'm there before because I can feel everything supporting that muscle and saying, remember, this is when you move over to the side so that we can see the carotid sheath or, whatever the anatomy is that they're trying to get to. And so I've heard confirmation that this was the easiest surgery, that the tissues seemed like they were moving themselves, that my team was just on point. They are often absolutely surprised how awake their clients are after surgery, how quickly they move through PACU and into recovery, how bright they look and responsive. Temperature's great, vitals are great, just kind of that coming homeness. So I hear a lot of very aligned validation, especially specific things like, we were really worried about this part, and when we were removing the I just did a carotidectomy and we were, removing some of the plaque. And so I visualized that it would come out all in one kind of like long tissue, that it would just flow effortlessly out and in one piece, because you want to be very careful that there's, not little residual pieces of tissue left in there. He said it just flew out in one piece, perfectly clear. And I thought, yeah, we asked for that.
Mm-hmm.
We asked for that. And the body was, and of course, these are incredibly skillful surgeons. These are, I think doctors are incredible. So I want to certainly acknowledge that there's a lot of skill in this room, but there's also spirit in the room.
Mm-hmm. How do you see energy? What gives you the ability to see energy, to work with energy, to move the tissues, so to speak?
Yeah, well, it's I came into this world very sensitive. I could always see energy. I could see the colors around people. I could hear messages that I sort of attributed to inner wisdom until later in life when I thought, I actually feel like this is more guidance than inner wisdom. It's like, how would I know these things? How would I know that? And yet I do, because I've heard it somewhere. And I have a really strong sense of physical empathy, like very physically empathic. So I actually track these surgeries in my own body. I can feel what's happening, and it's not scary. I've been experiencing this my whole life. And I can put my hands up and kind of trace what the surgical process is and how it's unfolding. And there's a sense also, there's the knowing. I can sometimes smell energy, which is really strange. It's like sometimes I'll be walking in the grocery store and I'll get a smell of like really heavy antidepressants. And I don't go through the world checking people out. That's unethical. But sometimes I'll just get these washes of awareness and I just let them go. But in a surgical space, if they're using certain types of medications, something will shift and I can feel it. And I know that is this medication. This is a blood thinner. I can feel it. It feels slippery. My mouth tastes like metal. So I've gotten kind of sensitive to some of the different energies of the chemistry that's even involved in the surgeries. And it's really neat. I was working with a prostate surgery, and I was sitting in the waiting room with this individual's wife, and I had not really spoken to them. This was a really long time ago about how this surgery would be done. And I typically do not talk to the family in the waiting room for a lot of different reasons. I will tell them when they open, I will tell them when they close, and I let the other communication come from the surgical team, who was a little more, quote, in the room. But I did look up to her. I looked up and I said, hey, so-and-so, by chance, is there a robot involved in this surgery? And she goes, oh, yeah, it's the Da Vinci robot. And I could feel it come in, and I knew that it was robotic, and then it was like, all right, well, now I need to talk with this in a different way, like reminding the tissues that it's okay, that this is supposed to be here. So I thought that was kind of an interesting story.
Absolutely.
Just around, how is it that you track this surgery? And there was this was kind of interesting. It was a shunt placement in the brain, in the brain, and the TV screen in the waiting room, you get the numbers, like the patient ID number, and they said, preparing or going into surgery. And it was like preparing. And then all of a sudden I felt it start. I was like, no, we've started. Nope. And I was tracking and I was doing the work, and we were working with, and then the kind of the catheter-like tube, that's not what it's called, but it's sort of the tube that goes down. I felt it all placed. And I just thought, I think this surgery is over. And then it just, the screen turned to beginning. And I thought, oh my God, I've really screwed this up here. And then they got the phone call that said, we've closed. And he's now in recovering or waking up. And I thought, oh, that was so affirming. I was like, I was there. I thought for a minute I was going bananas, but no, really, that too. As I continue to do this work and really dedicate in this space, I am getting the confirmations that, we are together in this, and it's so cool.
Is there a certain characteristic to your clients or people who seek you out?
I think that first and foremost, the clients that I have typically come with an orientation around energy medicine modalities. So they either see an acupuncturist regularly or are deeply involved in their yogic movement practices and are familiar with prana and the movement of energy in their body. Or there's some folks that are going into a surgery that is very risky, and that they're terrified, and that they want all the help that they can get. I don't know what you do. I don't care what you do. I'm terrified. I want to live through this, and I want all the help I can get. So those are the two families of folks that typically come and see me. But I think the demographic is changing.
What would a session look like with you? So they've taken you on as on their team. What does a pre-surgery and a post-surgery generalized session look like with you?
Yeah, so what we do is we start with just a conversation, and it's usually 45 minutes to an hour. It's not, there's no contract. I just want to listen. It's free. I want to hear what they're going through and where they are spiritually, emotionally, mentally, physically, if they're in pain right now, if they are fainting or not sleeping from stress, or their blood pressure's through the roof, or they're feeling really disempowered and confused. So all of those, the more than a physical body, all of those aspects, I listen to those. And then I come up with like a plan. And it's sort of a buffet sort of plan where I present a lot of different types of supportive appointments that we could do together. Some may be more trauma focused and really helping to look at hard questions like, well, I don't want to die. And what does that mean energetically? And how can I support that level of soul concern? And some folks are in deep pain, so they may want a few sessions that have more to do with the physical energetics, where we're helping to reestablish really good, strong flow of the energy, say between the left foot and the left hip, because they're going to have a knee replacement on the left side. And we want those channels of energy open and flowing because it helps to facilitate deep tissue healing. So we may do a little bit of physical type energy medicine. And then there's always a session. This is sort of a required session where we meet and we define where this individual would like to go. I call it their favorite place. What's your favorite place that you would like to go before the anesthesia is administered? Because when we put our body in our favorite place and we let the energy of place and earth support us, our bodies are more relaxed, our tissues are more relaxed, our nervous system is more relaxed, our energy is flowing better. So in one sense, it supports them in being really well grounded as they move into surgery. But that's also where I go and meet them in their favorite place for the surgery. And that's where we contractually know. It's kind of like they open the door for me to say, all right, come on in. I will let you be part of this surgical procedure. And it's in that favorite place, that's where I really have both permission and access to work with their body through the highest intentions that they have set up for themselves.
So I'm going to assume that this work is not able to be done online, that you need, especially with the touch therapy, that you are working hands-on with people one-on-one.
So actually, healing touch is done both hands-on and over distance. So I actually have a global practice, and it can be done all remotely. And I really like to fly up if I can and be with someone pre and post-op, because I've heard that seeing my face first thing when they check in, it's like I'm being held by my person.
Mm-hmm.
My person's here. And, you go through so many different nursing groups in the surgical process. There's pre-op, and then there's pre-surge, and then there's post-op and anesthesia and recovery. Like, you're handed off to all these different teams. And when I can be there, I'm a consistent face throughout the whole system, but the whole process. But if I'm remote, excuse me, if I'm remote, what I do is I keep really detailed notes with timestamps of what's happening and what I'm noticing. And we go through that together post-op. So it actually can be done both ways.
Well, if someone, when we talk about in the broader space, going out from specifically surgery, because I'm sure that you do energy medicine on a daily with people, are there some practices that you can, little tips for the listeners as we close off the show that people can use as a check-in to maybe promote better energy, or for somebody who is not going to be able to use your services in the near term and preparing for surgery, are there any practices that you can offer up to them?
Yeah, definitely. We could do like hours on this. There's so many amazing small things we can do. So first and foremost, I think it would be amazing if each of us took a couple moments and got on Google. I should probably create a sheet on this, but it's like type in language of energy, like how energy is moving. it's building a vocabulary of heat and cool and bumpy or spiky or free and light or dense. So there's sort of this language that our energy is always it's speaking in. And so if you place one hand on your lower abdomen and one hand on your upper chest, and you just sit and feel and breathe, just taking a couple minutes in the quiet, ask yourself, how is my energy flowing today? What do I notice about my inner world? And begin to partner that new vocabulary with what your inner experience is like. Because once we can name it, we can do something with it. That's sort of one of the limitations of language. It's never big enough, but it's a doorway to get us in. Mm-hmm. So step one is practice the language. 2, we hear this a lot, but just making sure you can always feel your feet on the floor. You know, so often we get in our head and energy flows where thought goes. And so if we're up in our head and our thoughts are spinning, more than likely your energy body has really migrated out of balance, and there's a whole lot of energy up in your head. And the feet, which is our grounding contact with the earth and our soul walk, we kind of lose sense of it. So making sure that you can feel your feet on the ground. If you're sitting, your bum in the chair, your back against the back of the chair, just trying to maintain a sense of the global body. That can be hugely important during pre-surgical or before you go into a meeting with your team or have a family meeting or walk into Thanksgiving or Christmas or, another holiday when you're with your family. Just making sure you have good contact with yourself.
Well, that's amazing. We're coming to the end of the show, unfortunately. Can you let us or let our listeners know where to reach you? Or do you have any offerings? Do you publish things like that? So where can they find out more information? Because I'm sure this is a very new domain for a lot of people.
Yeah, thanks, Cathy. So if you're interested in the surgery work, it's energymedicineinsurgery.com. And I've got a great little course on EFT tapping for concerns and anxiety. It's a short course. It's very, very, very affordable, but that helps open up the meridian channels, and partnering it with affirmations sequenced in a specific way can really help just discharging energy and helping to bring yourself back in full alignment with whatever you're presented with. And then my personal website is ameliavogler.com. And through the mail-in list, I give a lot of grounding tips, and there's a free short course in grounding. And then there's my institute, Vogler Institute, where I teach practitioners and also lay people if they're curious about this thing called energy.
Wonderful. We'll have all those in the show notes for sure, so you can check them out there. Amelia, thank you so much for being on the show. It was really, really nice to talk to you.
Thanks, Cathy. I really enjoyed it. Appreciate it so much.
Wonderful. Everybody, we'll talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Cathy Biase, here on Radio Maria Canada.